The recorded history of medicine in New Brunswick begins with the first European settlement in North America on St. Croix Island in 1604. Surgeon Guillaume Deschamps de Honfleur performs a post-mortem on the body of a French scurvy victim. Nearly half of the remaining French colonists will die of malnutrition during their first winter. The rest will be saved by Indigenous medicine men who provide a previously unknown remedy. It would be 200 years before the first Provincial Medical Act was passed, and government-appointed boards of health were established in the British Empire. Fortunately, well before the New Brunswick Medical Society officially emerged in 1867, New Brunswick physicians began the long tradition of care that continues across the province today. While they often kept offices in their homes, New Brunswick's first doctors frequently traveled great distance in service of their communities. Most country doctors owned 2 horses, so that one horse could be fresh if a second urgent call came. One of the New Brunswick Medical Society's earliest committees addressed workmen's compensation. This committee negotiated for improved medical and surgical fees for the care of injured workmen and helped to settle disputes arising between doctors and the Board of Health. The number of female doctors at the time was remarkable, considering their difficulty in obtaining a medical education. Dr. Mabel Louise Haddington became one of the first public health doctors of the province, serving under Dr. William F. Roberts, the first Minister of Health in the British Empire. Dr. Roberts began his practice in St. John in 1894. He was a pioneer in physical medicine and electrotherapy, and was the first to introduce radium therapy to the city. In 1918, under Dr. Roberts' leadership, vaccinating youth against smallpox became mandatory. This caused the disease to disappear from New Brunswick within 10 years. During the First World War, casualties among Canadian troops in France and Belgium were so heavy that more than half of all Canadian physicians served overseas. By the end of the Second World War, almost 35,000 healthcare personnel had served in the Corps. After the war, in 1945, the New Brunswick Medical Society adopted a new official emblem featuring the motto, Salus Populi Suprema Lex. The health of the people is the highest law. The Equal Opportunity Program, launched in 1967, saw the centralization of health services and a standardization of healthcare standards to address regional disparities. Poorer municipalities were now able to offer the same services as more affluent ones.
Le programme Equal Opportunity, c'était les années Robichaud, 60-70. Et puis, politiquement, il avait été sage. Il avait compris que 60% de la population vivait dans les communautés rurales. Il faut se souvenir qu'à ce moment-là, que dans le système d'éducation et dans le système de santé, c'était les régions qui en avaient la responsabilité et souvent c'était les comtés, des écoles de comté, c'était eux qui avaient la responsabilité. Ils avaient des petits bassins de population, ils n'avaient pas les infrastructures nécessaires, ils n'avaient pas les ressources pour offrir la même qualité de service que les régions plus fortunées. Et c'est là que c'est devenu important lorsqu'on a dit oui, on a une responsabilité provinciale de s'assurer que tous les gens dans la province, peu importe où ils sont, auront accès aux services d'éducation et aux services de santé chez eux, dans une région assez près, de sorte qu'ils n'auront pas à se promener nord-sud continuellement pour aller chercher ces soins-là. Alors, je crois que c'est ça que ça voulait dire, chance égale pour tous, equal opportunity.
My father, Frederick Goodine, was a bit of a natural leader and in some respects a pioneer in the medical profession in New Brunswick. He was one of a few physicians that was selected to work on developing the Medicare system prior to its implementation in 1970. He played a pivotal role in establishing Woodstock as a very prominent location for medical education in the rural setting. 10 years later, the extramural hospital was piloted in Woodstock and then ultimately rolled out all around the province.
Many society members have been active in politics.
In my case, I was very fortunate because I had an education degree and taught school, and I had education for the second half of my stint in politics, and that allowed me to understand the education system because I was trained, had a master's in education. But fortunately in health as well, having had the background in New Brunswick Medical, Canadian Medical Association, rural health care, I was able to address problems in the best interests of the population and those who provide the services, and try to make decisions even if they were not always welcome at the time. They were necessary at the time.
The first president of the Society, Dr. William Bayard, became the president of the Canadian Medical Association in 1894. Many past presidents have gone on to do the same. Dr. Dana Hansen, a former president of both organizations, became the first New Brunswicker to become president of the World Medical Association in 2010.
Well, as we know, New Brunswick has had many firsts in many different fields, but one of the areas has been the Hospital Without Walls. It became an extramural program, moving the care out of the hospital into the community. It was extremely well accepted, and of course, it was one of the best things for that particular group of patients. And it has been adopted in various forms since that time in any number of different areas, both within Canada and probably internationally.
So it's really important to have these teaching units and the medical school in New Brunswick. What I think we're seeing, certainly I've seen it with the residents that I've had, is that more of our New Brunswick students are staying in the province of New Brunswick. And I think really importantly as well is that their formative medical teaching years are happening in New Brunswick, so they're very aware, our future docs, of the issues concerning New Brunswick patients, the New Brunswick Medical Society, and they're really the future of the practice of medicine.
The New Brunswick Medical Society continues to monitor healthcare issues and develop recommendations on health policy. Efforts have been made to attract family doctors to the province. This has resulted in over 90% of New Brunswickers gaining access to a family physician, higher than the national average. Other contemporary efforts include decreasing the length of emergency room wait times, increasing the number of nursing home beds in the province, diminishing the prevalence of smoking, and the implementation of electronic medical records. The Society aims to make New Brunswick one of the top 3 healthiest provinces in Canada within 10 years. After 150 years, the New Brunswick Medical Society continues its pioneering efforts. For New Brunswick, the health of the people is the highest law.